Well, hi everybody. Nice to be able to talk with you. I'm going to be talking today with you for a little bit about what we call practice diagnostics. It's another way of saying statistics, metrics, KPIs, key performance indicators. They all essentially mean the same thing. And without wanting to sound too much like a cliche, as doctors and practice support people, you obviously know the importance of a diagnosis with patients. Without it, you'd be guessing. And this would be, of course, very dangerous to your patients, wouldn't it? The business diagnosis, similarly, if it isn't done regularly, results in poor decisions, poor judgment calls. It can be anything from being a bit off on how to approach dealing with a particular situation in the practice going forward, or it can just be a very poor decision and end up being quite harmful to the practice. So whether you're diagnosing an area of the practice, such as new patient flow, you want to make sure that your new patient flow is going up over a period of time. You seem to have, let us say, some holes in the schedule. Well, that would be a perfect time to take a look at that one statistic, new patient flow. Or you want to look at patient conversions. You seem to be getting a lot of people in, perhaps more than you were before, but the numbers aren't showing up at the end of the month or the end of the quarter. Well, that would be a perfect time to take a look at your conversion rate, the number that measures the ratio of people to whom you present treatment, who then start. And diagnosing an employee, for example, this is a very, very important thing to do. This is why we do job performance reviews. But using statistics, using key performance indicators is so important because it will give you the objective view of what's happening rather than just a subjective idea of what's going on. And you want to be able to be as objective as possible, particularly in a world where everybody has an opinion. And people love to be heard. They love to express their opinions. Some of them are good. Some of them are not very helpful. But this is why you have to use factual numbers in order to do this. Okay, you see my point? So this is why these diagnostics are so important. So let's go on now and let's take a look at, what are the most important statistics for general dentists to keep? Many of you are GPs, so let's take a look at this. Well, obviously, you need to take a look at your production. What is the dollar volume that is generated, produced in a given time period, let's just say in a given month? Obviously, a very important number to look at. Obvious, many of you already keep these two. Collections as well. Third number, new patients. Simply studying these numbers alone on a regular basis, and I want to emphasize this point, knowing what to do about these numbers. It's not just collecting them. It's not just having some really cool charts or graphs to look at. It's how do we use these? For example, the obvious thing is, if new patients were going up and production was going down, that would mean we're not converting the people who are coming in. That would mean there is some kind of internal problem in the practice. It could be the conversion rate. It could be that case presentation needs work. It could be scheduling or front office management might be poor. could be a number of things. Recall might be falling off and not maintained, so you're losing numbers there, you see. So these statistics are, one statistic by itself isn't really that telling. But when you have different numbers and you compare them to one another, then you really start to get a picture of what's going on. In a general practice, I always say that the most important metric to keep is active patients. I say most important, not because you would ignore the others, obviously, but an active patient is defined as an individual who comes back on regular recall. This is an individual who, because they're a regular patient in the practice, you will continue to deliver care to that person their entire life. And these are the patients that refer new people, they refer friends, they refer family into your practice. The value of a practice, a general practice, really has to do with the number of active patients that are coming in. So that you'd have if you're a GP. Now, if you're a specialist, let's take a look at. They're basically the same. You have production, you have collections, excuse me, you have consultations in specialty practice, let's say a perio practice or a surgical practice, an oral surgery practice. Often people come in for consultations. You all know it's a different type of care. It's more episodic. It's more of a medical model because people are not going to necessarily come in on a regular basis in a specialty practice. So they come in for a consult, and that consult will ideally result in that patient getting started. So case acceptance in a specialty practice is extremely, extremely important. And by the way, the case acceptance rate in a specialty practice should be substantially higher than it would be in a general practice, because the people who are coming in for consultations are in most cases sent to you by your referral base, your referring doctors. So they've been teed up for you, and they are set to come in on a recommendation. So of course the conversion rate should be much higher. Okay, so case acceptance, and similar to the general practice, in a specialty practice, this particular number is a very, very strong indication of the overall health of the specialty practice, and that is the active number of referrals. So what is an active referral? That is a doctor, another office that refers a patient into your practice in a given month. It's that total number of offices referring to you, and that needs to be kept on a monthly basis. When that number starts to go down and a specialty practice is losing more referral sources than they're gaining, then we have a problem. And there are numerous issues that can be uncovered when you see that. So those are some stats that one could keep in either a specialty or a general practice. There are others, and we watch them. Many of you, I'm sure, keep track of your ARs. Are they aging? Are they running much over 30, 60, or 90 days? Bad sign if they are. Watching those numbers, if your ARs are aging and they're trending and more are going into longer periods before they're collected, that means there is a collections issue that would point to your insurance coordination that would point to whoever it is in the practice who is responsible for collecting money. But obviously, an important thing to look at, what is your production per day? In order for you to make what you feel you'd like to produce in a given month or a given quarter or for the year, that's going to add up to production per day. The reason this is a really good number for a practice owner and office manager to keep in mind is because when that number starts to drop, then you know that overall the practice is heading into a decline. So production per day gives you a real close-in view on what's occurring. Production collections ratio, as I mentioned before, very, very important. You should be collecting most of what you're producing. Less, of course, insurances. And then, because we deal with many doctors who specialize in implants, we track in those practices the number of implants that are placed, because that becomes a very large revenue source in the practice. And if a doctor wants to grow that side of the practice and generate more implant production, then it would be important to watch that metric as well. So, and there are many others. To keep it simple, though, we just outline these. So, okay, now, so the question becomes, how do you do this? How do you keep all of these numbers? It's actually quite simple. Most of you have software that will track all of this. But if you don't, usually this task is assigned to the office manager. The role of the office manager, as we see it, is to keep the doctor informed about the most important data that he or she would need to know what to do about situations in the practice. So the office manager, certainly ideally on a weekly basis, but no less than monthly, would be sitting down and meeting with the owner or owners and going over these numbers, showing them what they are thus far, where they are for the year, where are you compared to last year? Is the practice going up? Is it going down? And as I mentioned before, looking at these numbers, if they are going into a decline, and deciding what do we do about things. After you do this for a while, you'll get to see the relationship of these numbers and how they affect one another. And it's just simply a matter of learning how to think with them. Because we've been doing this for decades, this is how we think. And by the way, let me make this point. I want to make this really clear. Consultants sometimes are put in this frame of, they're just watching the numbers. The numbers are really what's important. That isn't true. The numbers are simply an objective. Remember, they're not subjective. They're an objective means of measuring performance. Are there other things to look at? Well, you bet they are. But the numbers, generally speaking, as long as they're put in accurately, the numbers don't lie. So you can get objective data, and good management that really accomplishes things is not done emotionally. It's not dramatic. It's done by having real information, accurate information. Sometimes you hear alarming things. And you go, oh no, what's happening here? And then you look and you see, well, it's not that way at all. We hear it all the time on the news. We hear statistics that are put in a certain frame of reference that make a situation look much worse than it is or much better than it is. What we simply are trying to do is have you keep simple, clear numbers so you can take a look at it on a monthly basis and get a real clear snapshot of what's going on in each one of these areas. And then, of course, I'm going to cover a little bit about what you can do on these as well. All right, so let's go on. So now, depending upon who you are in the practice, depending upon what your position is, you would watch statistics in a different time period. And here's what I mean. If you look at this slide here, you'll see, okay, let's take production. Okay, so the office manager should be looking at that is the person who is trying to keep the doctor, the providers producing, focused on clinical, not dealing with office problems or issues. You want, of course, your doctors being able to present and deliver treatment. That is what you want. But the office manager, if that individual is really performing their duties fully, they are going to watch that production per day. And they're going to watch it very, very carefully. So by let's say the first 2 days of the week are terrible. Well, if I'm managing that office and I see 2 terrible days, and I'm not going to just sort of throw my hands in the air and shrug and I'm going to be effective, I'm going to take a look at, hey, what do we need to do for the rest of the week? We got 3 days. I got 2 or 3 days left now. What are we going to do? A good manager is proactive in dealing with this, and that's why they would look at that number on a daily basis. Your doctor, who is normally the owner of the practice or a partner, the doctor doesn't need to watch it on a daily basis. You don't want the doctor getting buried in the numbers. But weekly, absolutely, the doctor needs to take a look at what those numbers are. And then on a monthly basis, that's where, as in that third column, the doctor and the office manager would get together and really get a picture on what happened during the month, what were the numbers, what are the situations that we have to deal with. Often what you'll find is lower statistics correspond to other issues going on in the practice. And then, of course, on a quarterly basis, it's really important to take a look at that trend in terms of either active patients. Are we growing? Did we actually gain more? Did more people come in than leave the practice? In a general practice, there's probably going to be about a 10% attrition rate in a year. It's kind of a national average. So that means that you need to be bringing in certainly more than are going out. And that's why active patients are very, very important to watch. If you see that going down, then you're either losing them on recall. These are existing patients who are leaving, or new patients aren't coming into the practice. Active referrals, certainly that would be something on a monthly basis. Your PR person for that specialty practice would be watching those referral sources carefully. Are those numbers going up and down? If you see them going down, then you need to study that referral list more carefully and go, well, gee, who did we lose? And of course, the doctor would be looking at this quarterly as well. So that just to give you an idea of, you can watch them very carefully, or you have to step back and look at the bigger picture. That's why you have these, we have it broken down this way. Okay, so let's look a little bit more. So we have these numbers. Okay, so great, we have the numbers, terrific. So what do we do with them? All right, well, after a certain number of weeks or a certain number of months, you have to analyze the trend. What is the direction of the trend? Are the high points going higher, or are the low, and is it trending down? Is it a general movement down? Or excuse me, is it flat? Is it plateaued? This is something that we see a lot of. Now, don't be fooled by big peaks and valleys. That can fool you. What you have to look at, if you're watching the peaks, are the peaks continuing to go higher as you go forward in time? If they are, then even though there are big drops, that's still an uptrend. If it's trending down, if those lows, the bottom of the graph is going down lower and lower, well, then you have a practice that's on its way down. That's how you determine what the general trend is. And that's what you have to look at. You can have a tremendous month and really have a great month. But when that graph just pops up and spikes one month, what's important to know is, are you maintaining that? So analyzing these trends is extremely important. Let's look at this. Let's look at this a little bit further now. Okay, here's an example. There's an uptrending graph. Of course, it's kind of a classic, easy one. We can tell that's what happened. But what do you do when you want to analyze a trend? Notice where it started to go up. Notice that arrow, that vertical arrow there. What you need to do is you need to look at, how did this start? What were we doing that started this trending upward? Did we bring in a new employee? Did we get rid of somebody who might have been doing a really crummy job? Did we start doing more outreach? Or did we change our website? You have to isolate and really, really take a look at when this happened. The problem is that people will look sometimes at the wrong time period. They may look at, they'll try to look here. No, you have to go back to the beginning and go, well, what did we institute then? That's when we decided to train that office manager. Or, oh yes, that's where we started doing a lot of training on case presentation. That's where we were practicing we put scripts in place for when new people call in. Very important to do this regularly. And by the way, if you do this regularly, please hear me on this. If you do this regularly, what will happen? Over a period of time, you will start to know the things that cause your practice to go up. You'll just start to know what they are. And you'll also start to know the things that get in the way of growth and cause the practice to go down. And you can develop the ability to really control your numbers. A lot of times what happens is the things that people are doing that were causing the growth get dropped out. They get forgotten. Maybe the staff was being trained and they were practicing, they were doing role playing. Maybe you were having staff meetings, and during those you were doing a certain amount of role playing discussion about how to deal with certain issues, and then you stopped doing those. And within a couple of months, you see the practice starting to flatten out, you see. If you don't look at these things, you'll never understand why they've happened, okay? All right, so that's step two. Okay, so let's take a look at what do you do once you discover where this started. Now, you need to think. You need to look. You need to think. You need to discuss with those involved. You need to talk to the staff and the individuals who are involved in the process. You want to, let's say new patients are going up. Excuse me. Sorry about that. Okay, let's say that, okay, let me go back to my presentation here. Sorry, folks. Okay, here we go. So you need to talk, let's just say your office manager. What kind of training were they doing with personnel? Were new job descriptions generated? Was there any kind of emphasis going on? Did you have a meeting at which you instituted something new or something different? Was there more coaching and training going on? You know, sometimes these are subtle things. Sometimes there's subtle changes that can cause a practice to go up or down. I can tell you from having done this now for so many years, we'll look at a graph and then we will ask a practice owner and office manager, and we'll talk to the staff about things that occurred during the time just prior to the practice moving up or down. And invariably, we find major things that are happening. Really, I was just studying some charts, the other day. We found an obvious thing, and just right at the date that the practice started doing this certain training and coaching, the practice started trending up for 6 months. So very, very important to do these things. But you need to talk to staff. You need to talk to your office manager if you're the doctor. If you are doing this as the office manager, you need to talk to the doctor and gather that information. Okay, but you will find, most assuredly, you will find things that caused those uptrends and downtrends. Okay, let's move on here. So when a statistic is up, when it's moving up, you want to ask questions. You want to question those involved to help isolate the cause, okay? And if it's going up, you got to be very careful that you continue to do what was causing it to go up. Don't start to change things at that point. This is a fatal error that people running businesses make all the time. You know, we've all heard that phrase, you know, if it ain't broken, don't fix it. Right. So again, this is why you have to have statistics for various areas of the practice, because you can have one statistic going up and start to change a whole bunch of things in the practice. It can be very damaging. So you've got to be careful not to change things that are working, okay? And if something is working, then and it's causing improvement. Your front office is filling up your book. They're converting callers to appointments. Recall is tremendous. You're tracking that, let's just say. Well, that's an area you would invest in. That area is producing. So you want to put resources, time, energy, perhaps another individual into that area because it is already producing. You want to strengthen it, okay? And just keep watching the numbers after you do those things. Very important to do that. Okay, let's look further here. Okay, so now stats going down. Okay, so that's a different story. But you do the same thing. You take a look at, go back to when was it up? When was it up? Then take a look at just before it started to go down. You know, there could be a lot of different factors. Could be personnel changes, as I've mentioned before. Could be and it's not just the people. You can have somebody go in who's very competent, but they change a procedure. They're doing something differently. You bring somebody in who is in another office. They were very, very good. You're so excited to have them. They come in, you put them into a position, and they don't do it your way. They do it their way. And it doesn't coincide with what you're doing. Okay? Look at your schedule if things are going down. Did you make any changes to how you were scheduling? Your outreach, the volume of your outreach. You know, let's just say that you were doing a whole bunch of promotion to your existing patients on bringing in referrals. The staff is really on a campaign to do that. Well, maybe people just became unexcited about that and you stopped doing it. Well, that's going to really have an impact on your practice. So you have to take a look once again, just the way you would when things are going up. You must take a look at what could the contributing factors be that occurred before the changes. Now, when you locate something, you go, gosh, we were going up and we changed that. Just go back to what you were doing before. Re-implement it. You just re-implement it, you say. And you get your staff involved in doing that. But this is the most rudimentary type of process, and it can just have tremendous impact on a practice. And of course, for those of you who do coaching with us, we watch your numbers constantly. And so we can help you locate what these changes are so you can build your production up and you can generate ongoing growth. Okay, let's move on here. So I know there are going to be questions on this. I just wanted to give you some real basics. Gosh, we could do a 2-day workshop on how to manage the practice with statistics, but because of time constraints and the lesson that we've learned that these webinars really shouldn't be more than 25 or 30 minutes. We haven't. We're going to wrap it up shortly. For those of you that have questions for me or for your coach or your consultant, just feel free to email us or call or text. You know how to do that. We're always available and delighted to answer your questions and help you on this. But I hope you've gotten some of the basics on this, and I hope it helps you. And always look forward to hearing from you. And I wish you all the best. And thanks for listening. Take care.